on masks.
The pandemic is not over. June 15th is not the magic date or bullet.
County Public Health Officer Dr. Wilma Wooten says we're still seeing about 100 COVID-19 cases per day, but things are definitely slowing down as the state prepares to lift nearly all COVID-19 restrictions next week.
We are near the end of the tunnel. We are optimistic that the worst of COVID-19 may now be in the rearview mirror.
Another sign the situation is improving. San Diego is moving to the state's least restrictive yellow reopening tier. That allows for more capacity at businesses and group events.
And that is a tremendous testament to San Diegans' willingness to get vaccinated and a tremendous testament to our entire healthcare system.
County Supervisor Nathan Fletcher says San Diego is about 80% toward its goal to herd immunity. And in addition to the state's incentives, those cash prizes, county officials are doing their own, now partnering with the San Diego Padres, entering those vaccinated in raffles for tickets, and there will be 2 pop-up vaccination sites coming to Petco Park.
The first is coming this Saturday on June 12th, and the second is on June 26th. The first 1,000 people vaccinated at each of these Petco events gets a free commemorative T-shirt.
Officials say vaccine supply is not an issue.
We now have more vaccines than we have people that want to get vaccinated.
There's a big push this month to reach those unvaccinated with mobile teams. Then officials say vaccine distribution will be similar to flu shots, meaning the once very busy superstations will soon be closing.
When you have a fire and you declare a state of emergency, that state of emergency continues beyond, because it is a part of the rebuild, it is a part of the recovery.
County officials say to align with the state, they will be extending its state of emergency to the end of the year, but that doesn't necessarily mean more restrictions post June 15th.
Day-to-day life for San Diegans will revert to as close to normal as we've been in more than a year and a half.
County health officials are still tracking a number of variants that could be more contagious or less receptive to the vaccines. Public reports about our local COVID-19 situation will soon shift to weekly, and after next week, those regular weekly news briefings will only happen as necessary. Matt Hoffman, KPBS News.
We're kind of in that limbo right now.
San Diego Regional Chamber of Commerce CEO Jerry Sanders says with Cal OSHA pulling back its recently adopted masking guidance, some business owners are confused and frustrated, but he thinks it's a step in the right direction.
What they do doesn't always make a lot of sense, and I think that's the reason the governor and California Public Health said, wait a minute, what you just put out there doesn't make any sense at all, so go back and find a way to make this more understandable for everybody. So that's what we're hoping happens.
When California lifts nearly all COVID-19 restrictions next week, state health officials say vaccinated residents don't have to wear a mask indoors with a few exceptions, like when riding public transit or at hospitals and schools. Sanders is hoping that when the Cal OSHA board reconvenes next week, they too will adopt similar regulations for vaccinated workers.
As far as the masking requirements for employees and others, we think caution is probably the best thing until the guidance comes out on the 17th.
In Mission Beach, that's exactly what Belmont Park officials are doing right now, holding the course, which means having employees vaccinated and unvaccinated still wearing masks.
I'm still waiting for the guidelines to come out to provide some clarity as to how we can move forward with some of that.
Park General Manager Steve Thomas says aside from the employee masking questions, right now is a very exciting time with the state set to lift COVID-19 restrictions.
We're seeing people come out and they're coming out to have a good time. They're spending money, they're having fun.
Thomas will wait to see if there's new updated regulations from Cal OSHA next week. In the meantime, he's still trying to hire more employees.
Hiring's been difficult. We originally laid off 700 last April, which was pretty brutal. And then since then, we've been trying to ramp up since the reopening April 1st. And it's been tough. It's been slow going.
We saw a lot of people out at Mission Beach, and that could be an indication for a very busy summer season. Within a couple of weeks, Thomas hopes to have the outdoor park operating at a full normal schedule. The Cal OSHA board could decide to update rules for workers regarding face coverings next Tuesday, but the earliest they would go into effect would be at the end of the month. Matt Hoffman, KPBS News.
A North County teenager is among the 30 lucky winners of the state's vaccine lottery program. Governor Gavin Newsom was in San Diego today to meet 17-year-old Nancy Gutierrez from Vista.
That's good. So what happened? So someone called you and you thought, what, is your brother cranking you or something?
No, they called my mom and my mom came in and was like, Nancy, you won't believe it. And I was like, we didn't believe it at the beginning, but I think after a few more phone calls, we were like, okay, I think this might be true.
Nancy's winnings will be held in a savings account until she turns 18. Another round of 15 winners were chosen Friday morning. Each will receive $50,000. That includes another winner from San Diego County, making a total of 4 from our area. A lot of money is being spent to help make people and businesses whole. It's part of the financial response to the pandemic, $650 million in federal relief for San Diego County. Here's more on how local leaders are deciding where that money should go. It would be easy and understandable to think that we're basically done with COVID next Wednesday when the state's tier system of health restrictions expires. But the damage done to lives, to livelihoods, will linger. The County Board of Supervisors discussed how to distribute nearly $650 million of relief from the American Rescue Plan Act.
No one deserves to be homeless. No one deserves to be struggling. No one.
Mia Roseberry co-founded and runs Wounded Warrior Homes based in San Marcos.
We provide transitional housing and reintegrative support services for post 9/11 veterans with traumatic brain injury and post-traumatic stress.
Like so many nonprofits, Roseberry says she could use more financial help, especially when it comes to assisting veterans experiencing homelessness.
It was somewhere between 20 and 25% of the homeless are veterans in San Diego. So a significant funding from the county with regarding to housing would always be very helpful to, like I said, help us to plan for long-range funding.
Here's a big picture breakdown of how county staff is recommending the money be distributed. The lion's share, $307.5 million, would go to costs already incurred from the pandemic and money to deal with it into the future. As you can see, homeless services, small business, infrastructure, mental health, and premium pay for county workers who stayed on the job during the crisis would all get assistance.
A lot of small businesses still need cash support. So that they can pay their employees, pay their rent.
Though the Chamber of Commerce represents many types of businesses, Jerry Sanders says restaurants are among the hardest hit. Many shelled out thousands to build outdoor dining spaces, and with the on-again, off-again closures, purchasing food was a vexing proposition.
And they wouldn't know whether to buy it or not, and they'd have to just take a chance and buy it. And sometimes they just would end up throwing it away.
The premium pay portion of the money for essential county employees is opposed by Supervisor Joel Anderson. Overall, Chairman Nathan Fletcher says the help should be coming soon.
And our hope is by summer, folks will be able to benefit from those programs.
Programs that represent a big forward step in helping the people of this county recover from the COVID pandemic. The city of San Diego received more than $300 million from the American Rescue Plan. Part of it will be used in Mayor Todd Gloria's budget plan to avoid cuts in city services. One Southern California city is putting money directly into the pockets of some essential workers who were called heroes at the start of the pandemic. As Senere de los Santos reports, the point is to make sure those workers are not forgotten.
Static over it, that the city council would actually think about us.
Lucy Gilbertson is still in shock that the city of Oxnard will give a one-time $1,000 payment to grocery and drugstore employees who worked during the pandemic.
To me, it's showing how much they appreciate us working through the pandemic, and also that our hard work that we put into working through the pandemic and not just, going on unemployment.
Last week, the city council approved a $2.5 million grant from the American Rescue Plan, making this gratitude program pay a reality.
In Southern California, a lot of cities have been passing hazard pay ordinances, and Oxnard was looking into doing something similar for essential workers. So Oxnard had set up a plan that was going to cover just grocery workers. So we had some issues with that where we thought they were in the right direction, but we could expand the program to include more people. So we suggested the city include grocery and drug retail workers.
The $1,000 will go to full-time and part-time essential employees who worked a minimum of 3 months between March 2020 and March 2021. The United Food and Commercial Workers Union Local 770 and the Central Coast Labor Council advocated for employees who put themselves and their families at risk while keeping the community fed and healthy.
It was really hard. Very scary thinking that we might take this virus home to our families.
Oxnard is the first city in the nation to implement this payout.
It might be that they're behind in rent, and this will help catch them up. They might have incurred debt due to childcare needs, and this could help them, pay some of that off.
I'm a single mom, so I plan to pay a lot of my bills.
Senere de los Santos reporting. Childcare was one of the big challenges during COVID-19, and that includes our foster care system. KPBS reporter Tanya Thorne has a look at the move to close a group home in North County and how the foster care system will change after the pandemic.
In 2015, the Assembly passed a bill to eliminate most group homes for foster youth. The ultimate goal was to maintain a stable, permanent family for foster children. Congregate care, the use of group homes, was to be limited to short-term interventions. That's something Teresa Stivers says her organization did decades ago.
When we see the youth who enter our program at 18 from a group home, the majority of them don't have a GED. They have no life skills whatsoever. They don't know how to live independently or even out in the community. They've been told what to do every day, every minute of their lives.
Stivers is the CEO of Walden Family Services. She says when her foster care agency was established in 1976, they only worked with group homes.
So we changed very quickly to move into foster care in a family situation. Because if we don't teach these children to learn how to live in a family situation when they're young, when are they going to learn? It's going to be much more beneficial to them as they get older.
Raja Gainey was born into the foster care system and spent his childhood living in different places.
In between 7 to 11, I went through probably, I want to say around 9 or 10 different foster homes and probably maybe 4 or 5 different schools. I'd been in a couple different group homes by that time.
Gainey says that through his experience, he preferred the family setting over the group home.
Just the environment, it was more so just kind of like summer camp, extended summer camp. And, you know, that's fun for a kid, but for my education, it really suffered. I had challenges when I was moving back to certain foster homes. I was moving to new schools. So obviously, if you're somewhere for an extended period of time, once you get back to your regular routine, it's a challenge.
At 11 years old, Gainey found stability when he got referred to Walden Family Services.
They really supported, you know, me and making sure that I was stable. And then also when it came time for me to transition out of foster care, which was a challenge, Walden really stepped up and tried to find as many resources and opportunities to help me and other kids get out.
Gainey is now on the board for Walden Family Services, has a family of his own, and has stayed in touch with his mentor for 26 years.
Hey Raj, great to see you. How you doing? Good. How are you?
Walden offers a treatment team that helps individualize what each case needs, work that didn't stop because of the pandemic.
We continued to place children during the pandemic. We placed children who had COVID, and our nurse came up with a plan. The families agreed to quarantine. So we worked nonstop as essential workers. It didn't stop for us just because of the pandemic.
Stivers says she expects the entire child welfare system will be busier than ever this next year due to the aftermath of the pandemic.
Well, we're very concerned. You know, children are being seen for the first time in over 12 months. They're being seen by all the mandated reporters, whether they're in the doctor's offices, they're in sports, they're in the schools. So a huge number of children are entering into the foster care system due to all of the stress and abuse and neglect that's happened during the pandemic.
Another stressor for the system is the expansion of foster care to youths aged 18 to 21. Stivers says more resources, donations, and foster families are always needed. Tanya Thorne, KPBS News.
A children's hospital in Colorado declared a state of emergency recently, citing increasing numbers of youth suffering from mental illness. KPBS health reporter Matt Hoffman says local experts are also seeing surges that can be directly linked to COVID-19.
At this point, over a year into the pandemic, we have data. So we know that the rates of anxiety, depression, and eating disorders, they've all increased.
Dr. Willow Jenkins is a child psychiatrist and the inpatient medical director at Rady Children's Hospital.
Personally, I see children every single day.
She says there has been about a 25% increase in mental health visits to their emergency room.
Could be a variety of things, but to bring a child to the emergency room for a mental health issue, obviously it's something that's pretty acute and pretty severe. So our most common reason is suicide, whether it's the thoughts of suicide or actual action.
Dr. Jenkins says early interventions are key for preventing worse outcomes, and for parents that can be simple as talking to your kids a little bit more, especially if you notice something just isn't quite right.
And I know a lot of parents get kind of nervous or unsure of how to have that conversation. So I always tell families, please, please ask. If you ask, you're not going to make that child think about it more. It's not going to cause them to act. If anything, you'll get more information and potentially even save their life. This is very, very serious.
Rady Children's has a 24-bed inpatient mental health unit, which has been full, and during the pandemic, a new psychiatric emergency room wing opened up.
One of a few nationwide. It's a 6-bed specialized pediatric psychiatric emergency room. So it's staffed with a child psychiatrist, specialized nursing, social workers. Everything is geared to supporting the mental health of youth.
Jenkins says there are a number of reasons for the increase in visits.
The fears of getting sick. At this point in the pandemic, we've had children that have lost their parents to COVID-19. So there's grief and there's loss. And then there's obviously the indirect effects of the pandemic. So this is relating to school closures, being socially isolated, being away from friends and peers.
She says ongoing racial injustice issues and political tensions are also a factor, plus the stresses of parents who may have lost their jobs.
So warning signs for mental illness in youth. So those usually are if you're seeing your child become more withdrawn, not hanging out with their friends as much, not doing things they enjoy. If they're becoming more irritable, more angry, that's a key sign of depression in children and youth.
Jenkins says one of the most common fears from parents is if they think there's something wrong and they alert doctors, their child will automatically be put on drugs. But she says most mild to moderate cases can be handled with therapy.
Nothing is done without a full evaluation, talking to the family, reviewing all of the options.
San Diego County data shows in 2020 there was not an increase in youth suicides when compared with the previous few years. Anyone in crisis should call the National Suicide Prevention Lifeline at 1-800-273-8255 or visit their website, suicidepreventionlifeline.org. Matt Hoffman, KPBS News.
Vaccine diplomacy is part of President Joe Biden's agenda on his first visit to Europe. In England, the president made a big announcement about America's role.
We're taking a major step that will supercharge the global fight against this pandemic. In my direction, the United States will purchase an additional 500 million doses from Pfizer vaccine, that will donate nearly 100 low and lower middle income countries. They will be the beneficiaries.
The first doses are set to ship in August. The World Health Organization will coordinate the distribution. The United States and a handful of other developed nations have made significant progress in vaccinating their own populations, but vaccine supply remains a critical issue in most places around the world. A year and a half since the COVID-19 virus emerged, its origin is still a mystery. One theory that was discarded early on is getting new scrutiny. Dr. Sanjay Gupta has a closer look.
I'm still struck by what former CDC Director Dr. Robert Redfield told me in February.
I am of the point of view that I still think the most likely etiology of this pathogen in Wuhan was from a laboratory, escaped.
For a lot of people, it was stunning. Not so much what was said, after all, the lab leak theory had been out there for some time, but rather that the former director of the CDC was the one saying it. Someone with access to raw data and intelligence many others didn't have.
That's the way I put it together.
After largely being dismissed by the scientific community, the lab leak theory is now gaining new momentum.
We know that all laboratories everywhere in the world have had accidents, continue to have accidents, despite our very best efforts to prevent them.
David Rauman is a microbiologist and professor at Stanford. He penned a letter, along with 17 other scientists in the journal Science, writing, quote, "More investigation is still needed to determine the origins of the pandemic. Theories of accidental release from a lab and zoonotic spillover both remain viable." Now the question is, will we ever know? It's not easy. I mean, if you think about it, tracing the origins of a small strand of genetic material on a massive planet never is. Consider that it's been 45 years since the first recognized cases of Ebola.
This is as close as we can get.
And yet, we still aren't sure of its origins. Tracing SARS to horseshoe bats took 15 years.
Nearly all previous outbreaks of emerging infectious agents have arisen through natural means. Second, This virus does appear to be related to bat coronaviruses.
But just how closely related is a critical question. According to the World Health Organization, this coronavirus is 96% similar to another virus found in bats known as RATG13.
It's not close enough to say that it's the exact virus that gave rise to this one in a simple evolutionary step. That kind of gap, 4%, means years, means decades in terms of natural evolutionary time.
And that evolution means something. Typically, after a virus makes the jump from animal to human, it sputters along, evolving, learning how to become more efficient. That takes time. With SARS-CoV-2, the virus seemed to come screaming out of the gates.
Normally when a pathogen goes from a zoonotic to human, it takes a while for it to figure out how to become more and more efficient in human-to-human transmission.
So in the lab, do you think that that process of becoming more efficient was happening? Is that what you were suggesting?
You know, most of us in the lab, we're trying to grow a virus. We try to help make it grow better and better so we can do experiments and figure out about it.
According to two people briefed on U.S. intelligence, well before the first cluster of cases in Wuhan was reported to the WHO on December 31st, 2019, there were concerning reports of researchers from the Wuhan Institute of Virology becoming sick with some sort of pneumonia-like illness. Were they the first patients in the world to contract COVID? We don't know, and we were told they tested negative for antibodies, but that hasn't been independently confirmed, which leads to perhaps the most crucial parts of a successful investigation: access and trust.
If we can convince the scientists in China and Wuhan to sit down with us and share everything that they have, and we likewise share everything that we have with them, I really do think that we can make some headway.
Dr. Sanjay Gupta reporting there. Back here in San Diego, two major sporting events will be part of our reopening next week. Some of golf's best players will be here at Torrey Pines for the U.S. Open tournament, and the Padres will return to Petco Park June 17th for their first full-capacity game since 2019. They're planning a big celebration called San Diego's Opening Day. There will be special giveaways along with a military flyover and a tribute to frontline healthcare workers. The biggest sporting event on Earth is a month away. Tokyo is the host city for the Summer Olympics, already delayed a year by the pandemic. Selena Wang spoke to volunteers who are worried the Games can't be held safely.
I think it's very cheering human lives. Yeah.
Jun Hatakeyama is one of some 10,000 Tokyo Olympic volunteers out of 80,000 that has quit amid pandemic fears.
I just quit because for my health condition and to show my opinion that I'm against for the Olympic game.
When college student Hatakeyama signed up to be a volunteer, he was excited to witness the world's best athletes come together at this Olympic Village. Instead, he's witnessed mounting problems.
The Olympic game is very challenging human lives. Our lives are not normal, so it's emergent now. So I think why we can hold an Olympic game in 2020 now.
Welcome to the London Expo. An army of enthusiastic volunteers has been key to the success of recent games, helping to operate venues, assisting spectators and athletes. Tokyo organizers say fewer volunteers this year won't impact operations, given no foreign spectators and downsizing of events. But volunteer Nima Esnashari, a language teacher who lives here in Hyogo Prefecture, says protection hasn't been nearly enough.
What COVID protection have you been given as a volunteer?
We are going to get 2 masks and a bottle of hand sanitizer.
So that's it?
That's it.
Volunteers are asked to take public transportation between their homes and Olympic venues. And for those who live outside of Tokyo, they have to find their own lodging. Esnashari hasn't quit yet, but says he's thinking about it.
I could be bringing back COVID to my family.
Organizers say the Olympics can be held in a safe bubble with the majority of the Olympic Village vaccinated, but many public health experts say that's impossible, especially if there are tens of thousands of largely unvaccinated and untested volunteers at Olympic venues across Tokyo and Japan. and less than 4% of Japan's population fully vaccinated.
We are not being given neither testing nor a vaccine. And we have to go in and out of the bubble at all times. There's a significant potential of this becoming a super spreader event.
Normally a symbol of national pride and excitement in the host country, many volunteers this year instead are scared, largely left on their own to protect themselves from COVID-19.
I think the meaning of Olympic Game was completely forgotten.
Selena Wang reporting. And that's it for this special edition of KPBS News. I'm John Carroll. From all of us here at KPBS, thank you for joining us.